Hello students, welcome to Angel Health Academy. Topic for the day or topic for the session is major health problems in India. Health problems in India. Every country has its own health problems. That means the health problems will vary to country or nation to nation, depending upon the various factors such as size of the population. We know that India is the richest population, okay, highest population in the world. So according to the size of population, then according to the standard of living of the people, our standard of living varies. We have different cultures, different religious practices, different traditions, etc. Okay, so depends upon the standard of living of its citizen. And last one is the geographical condition of the different states or the country. Geographical condition of that particular country. Okay, that means every country has its own health problems. That means each country has different types of health problems. So there are many factors which influence the health problems of a country, but these are the most important or most common factors, that is size of the population, standard of living and geographical condition of the country. Now let us talk about the causes of poor health in India. What are the different reasons or causes for poor health in India or to have number of major health problems? So there are three important types or classification of causes for poor health in India. First one is environmental causes. Second one is socio-economic causes. And third one is other causes. Environmental, socio-economic and other causes. First one is environmental causes. Under environmental causes, the first cause is lack of safe drinking water, especially in the rural area or for the remote area and remote people. So, lack of safe and wholesome drinking water. Second one is lack of basic sanitation. Okay, lack of basic sanitation or sanitation facilities. Then third one is crowded and insanitary living conditions, unhygienic living conditions, crowded and insanitary living conditions. And fourth is pollution of water, food, soil, air, etc. Okay, pollution of water, food, soil, air, etc. So these are some of the important causes under environmental causes for poor health in India. Second major cause is socio-economic causes. It includes poverty, okay, then illiteracy, lack of education or ignorance, okay, then prejudicial customs, practicing different prejudicial customs, traditions, beliefs, cultural patterns or cultural activities or unhealthy practices, etc. The last one is inadequate nutrition or taking imbalanced diet. Okay. Then third one is others. Okay. That includes uneven distribution of the doctors, nurses and other health personnel or health workers or health staff in the urban and rural area in various healthcare agencies or health setting or health sectors in India. That is uneven or unequal distribution of doctors, nurses and other health personnel or health staff. So the second cause is, though the government take plenty of measures, initiation to render the health services, still there is an inadequate access of or development of healthcare services. That is especially even primary healthcare in the remote and rural area, okay, for the marginalized population, okay, or for the underdeveloped area for the underdeveloped population. That is inadequate development of primary healthcare. So these are the important three types of causes of poor health in India. Next is determinants of health status of India. What are the factors influencing the present health status or current health status of the people in India? The first factor is demographic condition of the population. Demography, that is size of the population, number of population. Okay, as we have already discussed, we are the highest populous country in the world. That is demographic condition of the population. Second one is educational status or literacy status of the population. Educational status. Third one is food production in the country. How much food we are producing for the citizen, food production of the country. Then fourth one is nutrition status of the people in the country or citizen of the country. Nutrition status. Then next is income, national income of the country or income of the citizens. Okay, national income of the country or total income of the citizen of the country. Then sixth factor is vital statistics. That is mortality rate, morbidity rate, disability rate, dependability rate, etc. All comes under vital statistics. So our health status is directly based on vital statistics of the country. Then various government and private health initiatives, health programs, health plans and health policies, national health policies, population policies, education policies, etc. There are different health policies for the betterment of the country. Okay, that is health initiatives or health programs, health plans and policies. Then eighth one is health manpower. Okay, health manpower means health workers. We are already discussed that uneven distribution or lack of or scarcity in the or inadequate health manpower in India to render the quality and comprehensive healthcare services. The ninth point is medical and healthcare accessibility or availability to the people. So this point also we already discussed that there is a lack of accessibility, okay, or less accessibility, especially in the marginalized group or the underdeveloped area or remote area or rural area in the country. That is inadequate medical and healthcare accessibility. So these are the 9 different determinants or factors which influence the health status, total health status of the country or the health status of the people in the country. Now the fourth one is classification of major health problems in India. What are the classification or types of major health problems in India? So there are 8 major health problems, okay, 8 important major health problems in India. For the exam purpose, we are classifying the major health problems in India or issues in India. That is 8 major health problems. In that, first one is communicable diseases problems, communicable diseases problems. Second one is non-communicable diseases problems, NCDs problems. Third one is nutritional problems. Then fourth one is D is MCH related problems, maternal and child health related problems. Then fifth one is environmental sanitation problems. I have been already uploaded a video about the environmental sanitation problems, issues and suggestions. So please go through that to understand better about environmental sanitation problems. Then sixth one is medical healthcare problems in India, medical care problems in India. Then seventh one is population explosion or population problems in India. And eighth one is, last one is other problems. We have various other economic related, income related, education related or even social problems. Okay, that all comes under other major health problems. So these are the 8 important classification of major health problems. In this video, I am not going to explain in detail about all the specific problems. I will make separate video for communicable disease problems, non-communicable disease problems, nutritional problems, MCH problems, etc. So this is the video, that is you can use the part 1 as a general major health problems. If you have a question like major health problems, this video you can answer. If you have a specific question like communicable disease problems, I will be uploading another video only about a communicable disease problem or significance in India. Then non-communicable disease problems, I will be also uploading that video also. Like that I will upload all the videos as the importance and significance for the exams. So first is about communicable disease problems. Communicable diseases are continue to be a major health problems in India. As you know that we have many outbreak of infectious diseases. Nearly 54% of the death in India are due to communicable diseases. So communicable diseases contribute to nearly 54% of the death. When you take all the death in the country, out of that 54% is from communicable diseases. Okay, the major communicable disease prevalent in India according to significance are diarrheal diseases, filariasis, that is lymphatic filariasis, ARI, acute respiratory infections, STD or STI, sexually transmitted diseases, TB, tuberculosis, HIV or AIDS, malaria, leprosy and others. The other important communicable diseases prevalent in India are dengue fever, chikungunya, leptospirosis, Japanese encephalitis JE, Kala Azar and hepatitis. So these are some of the important communicable disease prevalent in India as a major health problems. So of course I will be making a separate video about the major communicable diseases in India, prevalent in India, according to its morbidity, mortality and other significance. Okay, I will be explaining in detail about all the communicable diseases which is prevalent with its significance in that video. The second classification is non-communicable diseases prevalent in India, that is NCDs problems in India. India has a significant burden, okay, of non-communicable diseases, and the number of diseases, cases or incidences have been rising or increasing every year or over the years. According to World Health Organization WHO report on non-communicable disease global survey indicated or revealed that 1 in 4 Indians, so every 4 person in India, in that 1 person is facing the risk of death or having death from non-communicable disease. That is 1 in 4 person in India before the age of 70, he has the risk of having mortality or death from the non-communicable diseases. The major non-communicable diseases prevalent in India are, according to significance, hypertension, obesity, CKD, chronic kidney diseases, DM, diabetes mellitus, CRDs, chronic respiratory disorders that includes COPD, chronic obstructive pulmonary diseases, COPDs, then CVDs, cardiovascular diseases, then blindness, stroke, rheumatic heart diseases, that is RHDs, cancer, accident, etc. So these are the major non-communicable diseases prevalent in India. I'll be making a separate video regarding non-communicable diseases prevalent in India with all the significance, morbidity, mortality and other general significance or informations. So in that video, I'll be explaining all the information what is required for writing the specific topic of non-communicable disease problem in India with this table. Okay. The third major classification is nutritional problems in India. Nutritional problems in India. So nutritional problems or malnutrition is widely prevalent in India. Okay, especially in the vulnerable people or vulnerable groups such as pregnant women, lactating mothers, that is nothing but nursing mothers or mothers who breastfeed the babies, that is lactating mothers during postnatal period and after that. Then growing children, especially under 5 children and the adolescent, all have a lot of problems with the nutritional deficiencies. Okay, the major nutritional problems prevalent in India include undernutrition, overnutrition, inadequate dietary diversity or inadequate balanced diet, food insecurity or inadequate supply of food, poor infant and young child feeding or breastfeeding practices or formula feeding or other normal feeding practices, gender disparities in selection and consumption of nutrition, that is gender disparities, male and female difference, then poor sanitation and hygiene during the preparation and serving of the food, that is poor sanitation and hygiene. And the 8th one is limited access to health care in relation to the nutrition and nutrition education to the public, that is limited access or availability related to health care related to nutritional problems or deficiency or IEC program on nutrition education or balanced diet or ICMR recommendation for the daily calorie or other requirements for the people in the community or citizen in the nation. Okay, this I will be explaining in detail in the next video when I upload about the nutritional problems in India. Okay, in that I will be explaining with this table for more significance and more information about the nutritional problems in India. Then fourth major health problems in India are MCH related problems or maternal and child health problems. Maternal and child health problems or MCH remains a critical area of concern or giving importance or focus in India for rendering all the government services, with various challenges we are facing that is affecting the overall well-being of the both mothers and the children. So MCH services remains or become critical area of concern in rendering various community or public health services in India, with various challenges the government has to face to promote the well-being of both mother and children in the country or the nation. The major maternal and child health problems in India are maternal mortality, child mortality, okay, that includes even infant mortality, nutritional deficiency among the mother and child, reproductive health or adolescent health or RCH related problems, access to healthcare services for mother and child, then antenatal and postnatal care services in India, infant and young child feeding practices in India, immunization or vaccination of the under 5 adolescent and pregnant women, and mental health of the mother and child are all the important MCH related problems in India. I will be discussing separately with the video of MCH related problems in India. Okay, all these features I will be explaining in detail in that particular video, so that you can write the examination with the specific information of maternal and child health problems in India, both community and even in OB, obstetric and gynecology. The fifth one is environmental sanitation problems. The fifth classification is environmental sanitation problems in India. I have been already uploaded a video regarding environmental issues, environmental problems and suggestions like that. Please go through that and understand more about environmental sanitation problems in India. So environmental sanitation problem is the most difficult problem in India or by the Indian government to tackle. Okay, so it is the most difficult problem to tackle or to solve in the country. Okay, as it is a multi-faced or multifactorial problems. Okay, because there are number of factors will affect the environmental sanitation. For example, the pollution, it includes water, air, soil, food, etc. Like that, there are different factors are contributing the environmental sanitation. Thus, it is the most difficult problem to tackle in our country. Okay. The major environmental sanitation problem includes access to clean drinking water. That is especially in the rural area, people have poor access. So, access to clean, safe drinking water. Then sanitation and waste management services availability. Then third one is solid waste management problem. Then sewage and drainage system. Okay, its management, proper disposal of the excreta and other liquid waste. Then air pollution, industrial pollution, soil contamination, climate change impact. That is climate change impacts on the disease and healthcare practices of the people. Then public awareness and education about the environmental sanitation and environmental control. Okay, public awareness and education about environmental sanitation. Then others, there are many other problems or issues in relation to environmental sanitation problem that I have been already uploaded a video. In that I have been clearly mentioned about the various issues, various problems and the solutions and the suggestions to tackle that particular environmental sanitation problems. Then sixth major classification is medical and healthcare problems in India. Medical and healthcare problems in India. India has national health policy started in 1983. Later it is revised many times and latest we have a national health policy 2017. But we don't have the national health services, a pattern of comprehensive health services in all the states or throughout the nation because of the inadequate finance resources, budget and other resources such as man, money and material. Okay. So India has national health policy to render the services, but unfortunately we don't have national health services, that is a uniformity or same pattern in all the states and territories of the country. Okay, the medical care in India at present is mainly based on or mostly based on the Western medicines. We are mainly dependent upon allopathic medicines. That has many advantages and disadvantages or merits and demerits. Okay, so for example, it is very costly. Okay, allopathy or Western medicines are very costly. It is complex in nature. It is complicated. Its treatment pattern or protocol is very complicated. That is complex in nature. It is mainly urban oriented. Okay, it is seen in the urban area. 75% of the care agencies or health infrastructure in India are in the urban focused. Okay, so especially the Western medicine or allopathy medicine is urban oriented. Then it is mostly curative in nature, not preventive, promotive or any other area. It is only for the treatment of a particular disease the patient avail at the hospital or healthcare setting. That is mostly curative in nature. So because of that, it is hospital based service. Allopathic or Western medicine is hospital based. Then it is only focusing the disease, not the person. So it is disease oriented, not patient focused. And of course, it is not accessible to all the bulk of the rural population because 75% of the healthcare services or health infrastructure is available in the urban area of the country at present. Okay. So more than that, we have many key issues in relation to medical and healthcare problems in India. That includes access to healthcare. As we have said, it is more available in the urban area than the rural area. Okay. Then healthcare infrastructure. So government is having less healthcare infrastructure when comparing to the private sectors. Okay. And Because of the decreased manpower, decreased budget or finance, government cannot render the comprehensive and quality services for all the people in our country. Okay. Of course, we have a shortage of healthcare workers, especially in the government sectors and even in the private sectors. Then that affected the quality of care or quality of services, especially in the rural area. And of course, indirectly, that also may affect the affordability or availability of the healthcare. As I already discussed, 75% of the healthcare services in India or health infrastructure in India or hospital setting have been concentrated on the urban area. Only 25% only avail in the rural area, where 70% of the people in India are living in the rural area. Okay. Then sixth point is health insurance coverage. Of course, government has planned and started health insurance coverage for the public as Ayushman Bharat or Pradhan Mantri Jan Arogya Yojana with 5 lakh rupees for the family for the secondary health care. But still, government cannot cover all the people in the country to avail the health care insurance. Okay. So we have both private and government sector contributory and non-contributory health insurance coverage, but still the government is unable to cover the medical insurance for all the people in the country, especially in the rural area. Okay. Then because of the deficient manpower, money, material, etc., we have disparities in healthcare services in the urban and rural area. That comes under urban and rural disparities. Then inadequate public health services. Government cannot render public health services adequately, even for urban slums and even for remote area or rural area. Then health information system or health management information system. That is recording of the patient data in a computerized system. That is called a health information system. That is HIS or health management information system. Though government is taking more initiation in that, but still it couldn't reach the peripheral area of the healthcare settings or health infrastructure in the country. That is regarding health information system as the key issues in the medical and healthcare problems. The ninth one is regulatory and governance issues. Of course, government has less infrastructure and government has less power on the private sectors. Okay. So of course, there are issues, some issues related to medical and healthcare in relation to the legislations, that is rules and regulations, policies, okay, norms, etc., Public Health Act, etc., and governance, that is the control over the private sectors. So there are many issues since government has lack of the or shortage of the manpower, health manpower, money and material to render the comprehensive and quality related health services. Then others, like that there are many issues in relation to healthcare delivery system and healthcare infrastructure and healthcare access to, especially for the rural people. So these are some of the key issues related to medical and healthcare problems in India. Then seventh classification is population problem or population explosion. As you know that India is the most populous country in the world. Okay. Whereas we have only 7th of the land area in the world, but we are most populous country. The current population of India, today's population is 145 crore 67 lakh 54,921 as of Friday, December 13, 2024, based on the worldometer. Okay. So when you write exam, before that you just go through that and just to see that worldometer, what is the current population, that only you have to write. Okay. I am talking about the current population of India, that is a present, that is 145 crore 67 lakhs 54,921 as on Friday, December 13, 2024, based on the worldometer. So every second it is changing in the worldometer and you can find out from the worldometer before your examination. Okay. So this population we can also tell in different standard, that is billion, million, crore, etc. So when you consider as a billion, we have 1.45 billion. See that 145, that is 1.45 billion. Okay. And in million, you can tell that 1456 million population, 1456.7 million. Or you can just tell that first 3 digit, that is 145 crores. So that is the current population. As we are very populous or most populous, we have a number of or plenty of problems with other areas. Okay. So actually population is the manpower, but the problem is India has large younger population, that is below 25 years. So mostly they are not the part of the national income of the country. Okay, so India has a large younger population that is below 25. That is 50% of our total population. Of that 145 crore is dependent population. Okay, then at the same time, so more than 10% of the rest of the 50% people, they are old age people, they are above 60 years. So both these old age people and younger population below 25, they are not contributing to the national health income. Okay, thus roughly or approximately our total dependency ratio in India is around 50%. That is 50% of the total people in India are dependent on another 50% of the people in the country. Okay, so Indian national income or GDP is mainly contributed by the 50% of the total population in the country. Okay, then moreover, as the advanced technology and the advanced healthcare services, the proportion of the elderly also increasing. Okay, so as the elderly people or population increasing, the government has big burden or greater burden, that is they have to plan a separate healthcare services to focus the elderly and their welfare and their promotion. Thus, population health problem or population explosion is the biggest health problem in the country that affect all the areas of development of the nation or the country. Okay, some of the key issues or major issues in relation to population growth, population explosion or population problem includes one is population growth only. Okay, so India is the most populous or highest population country in the world. So government has to render many services for the population, and population explosion led to urbanization. Okay, people started to migrate from rural to urban and modification of a rural area to urban area. So development and urbanization led to a number of problems regarding overcrowding, okay, insanitary living condition, urban slums, etc. That is also because of the high populations. Okay, then population growth or population explosion also led to reduction of the resources. So that is resource strain, man, money, material. That also affected all the areas of the development of the country. Then there is a direct impact on employment, okay, and economic opportunities for the people. If the population is huge, government cannot render or afford the or provide the employment opportunities or other economic opportunities for its citizens. Then of course it indirectly affected with the education and healthcare access to the public. So population explosion or population growth is affected in the almost all the areas of the development such as urbanization, resources availability, okay, employment and economic opportunities for the population, healthcare access or services to the public, educational access to the public or availability of the public, infrastructure development in various areas in the country. Then indirectly that led to environmental problem, environmental issues such as air pollution, water pollution, food pollution, soil pollution, etc. That is environmental impact because of the excess of population. Then indirectly that led to social and cultural issues and cultural problems and practices from the different type or group of people. Okay, then recently we have another problem we have just now discussed, that is aging of the population. So after 60, because of the advanced technology, people are going to survive for more than 85 and 90. That also led into a problem to the government to render more services in the areas of the aged people. Okay, geriatric nursing for the geriatric people with the geriatric care and other geriatric health promotion or healthy lifestyle promotion activities. Okay, then 10th one is policy and planning. So government has to make various policies to tackle these issues of population growth and different health planning. So that also led into more budget. Okay, though we have scarcity in budget, manpower and other resources, so government has to take more programs, more plannings, healthcare plannings, socio-economic developmental planning and different policy making. So like that there are many issues in relation to population explosion and population problem in India. Because of that it is said the population explosion is the biggest health problem or major health problem in India. The last is 8th one is other problems. So other problems includes economic problems and social problems. I think you might have studied in detail about social problems. Economic problem includes a human resource problem and poverty. Okay, human resources related we have already discussed in population explosion program, that is 50% of our population is dependent. Okay, so government has to take care of or provide all the services in different areas of development for those people. Okay, so that is the burden to the government to render the various services. That is human resources related problem. Then poverty, of course 50% is dependent, that become poverty because government of India cannot help or provide needed basic services or other services or economic support to these people. That led into poverty. That is 1/5 of the total Indian population are under poverty. Okay, below poverty line. 1/5 of the total population of the country are in or under poverty. Then in other area we have social problems. So population explosion led into various social problems that is related to culture and customs. So people are following different unhealthy culture and traditional practices that led to number of medical problems and other general issues and problems. Then literacy, of course government couldn't render the education for all those people in the country, though government is trying for free of education up to secondary level. That led into illiteracy or ignorance about the people, especially in the northern region. So that is the another problem, that is illiteracy or lack of knowledge. So third one is others. Others include prostitution, handicapped children, juvenile delinquency, dowry system, substance abuse among the people, unmarried mothers. Now recent trend is there is increased unmarried mothers. So government has to take care of this or to support with various schemes and initiatives for the welfare and promotion of the unmarried mothers. Okay, that also is another social problem. And old age we have already explained. Okay, more than 10% of the Indian population become old age, and that is increasing day by day, and they need special attention and special care, and government has to focus special healthcare delivery services. So these are the other major health problems in India. So far we have discussed about the 8 different major health problems or issues in India. Okay, so if it is an essay question, you can summarize all these points and key points. Okay, so thanks for watching. Hope this video really benefits in your studies and exams. If you feel it is really worth and beneficial, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the next an important academic video. And don't forget to convey your regards in the comment box. So once again, thank you for watching my video. See you and take care.